Pittsburgh's Talk Radio.
1320 WJAS.
1-800-624-1170, BloomDaddy at iHeartMedia.com. One of the big stories out there, sign-up season started Sunday for health insurance under the Affordable Care Act, or Obamacare, now in year 3. And premiums are going up an average of 7.5%. They could be much higher depending on where you live. Health insurance expert runs the benefit resource group, Danny O'Connell, joining me now. Danny, good morning.
Good morning. Thanks for having me.
No problem. Why isn't the Affordable Care Act more affordable for everybody, Danny?
Well, there's a lot of reasons why. Number one, when you really dive into the bill, there's nothing in there that really lowers the cost of insurance. Cost of insurance will continue to increase at an increasing rate. The idea when they kind of put this together was, okay, we're going to offer subsidies to offset those increases. The problem, though, you look at half the people who got subsidies the first year had to give money back. And on top of that, are those subsidies going to keep up with the increasing cost of insurance, which is probably not.
I was looking at this story, self-employed accountant Fred Imo, and he's one of many. I mean, there's a lot of stories out there. This guy is in Oklahoma. He buys insurance for his family through the health insurance marketplace. He learned his premiums are going up from $1,100 per month to $1,700. That means he could pay $20,000 next year for health insurance, an increase of 66%. I mean, how is anybody supposed to afford that?
Yeah, they're really not. And the other part that doesn't tell is the hidden increases in there. So, for example, losses to access to providers of people that you want to see. Limits do go up a little bit each year. And so there are some other hidden things in there. Don't think that your plan is the exact same, just like it was last year.
Talking to health insurance expert Danny O'Connell right now. And to be fair with this story, premiums vary widely. And you can find there's a couple states where they're decreasing. Indiana's down 12.6%. I think Mississippi's down 8%. But in most states, premiums are rising. 31.5% in Alaska, 36% in Oklahoma. Why are some of these prices rising so quickly, Danny?
Well, it all has to do with how the pool is ran and how they're all pulled together. So, for example, in the state of Texas, you look at Blue Cross, they had a $400 million loss on 367,000 lives. That's unsustainable.
So what are people supposed to do? Just keep searching? I mean, what's their alternative?
Yeah. First of all, I recommend that you really work with a good independent local agent in your area. And if you have a hard time finding one, there's some good resources online using nahu.org. And I'm listed in there along with a lot of people. It's national. So a lot of those advisors have gone through. They've done their CMS training certification. If you're eligible for subsidy, they can typically get you the subsidy. If you want to buy direct from a carrier, they can do that. And from a consumer standpoint, it's really evaluating, okay, what am I really expecting to pay for and to use this next year?
Let me ask you this, and this is the main question. The people that Obamacare was designed for, are they better off right now than they were before, in your opinion?
That's a tough question because, I do a lot in Texas. In Texas, you look at, there are some people who are better off. A lot of people who are in the uninsurable risk pool, which the state ran, their coverage many times got worse for the same cost. But then the overwhelming majority, it's meant a massive increase.
All right. Hey, Danny, I appreciate your time. Thank you so much.
Thank you.
All right. That's Danny O'Connell, once again, health insurance expert, runs the benefit resource group.